Hello everyone, and welcome to Top 10 MRI Suite Safety Planning Principles, brought to you this week, MRI Safety Week, courtesy of Metrasens. A little about me, your presenter. I'm Tobias Gilk. I am an architect with radiology planning, one of the founding board members of the American Board of Magnetic Resonance Safety. I am a member of the ACR's MRI Safety Committee and one of the contributing authors to the 2020 Manual on MR Safety. I've also founded Gilk Radiology Consultants, my own consultancy, and with and through GRC, I do work for Metrasens and their clients on MRI safety. So that's a bit about me. My role with the ABMRS, because of that, I'm free to speak on MRI safety topics. I just can't talk about anything related to the specific contents of any of the ABMRS examinations. Which brings us to today's presentation about physical environment safety. Facility safety, obviously, yes, it's much easier if we're buying a new magnet or we're doing a renovation to radiology, the MR department, or building a new hospital or an expansion. But that's not the only time that we could or should consider safety in the MR suite or the physical environment. If nothing else, I would encourage you to do an assessment of your existing facilities. This helps you identify things that you currently do well and things that you wish were done better at your facility. And the reason for evaluating your existing condition is to develop a wish list, a prioritization list that helps to define what you will do when given the opportunity. And if, God forbid, your magnet decides it wants to die tomorrow, you're going to have your hands full just associated with the equipment replacement. And then is not the time to start trying to think about, well, how would I do things differently? If you prepare the how would I do things differently list in advance, then when the opportunity presents itself, you are in a much better position to take advantage of that. So let's move on to our top 10 list. And the first item on the top 10 list is one that actually I was tempted not to include at all, and that's the zones, because in some ways I think that this is really rudimentary for a lot of us. It's now requirements under accreditation standards and building codes, but let's treat it as sort of one of the foundational principles that it really is. So the basis of the zone concept really revolves around zone 4, the magnet room. And as we move away from zone 4, away from the region of maximum persistent MRI safety risks, the risks get lower and lower, and our physical security can step down. So zone 4 is where the magnet lives. What defines zone 3? A lot of us think that zone 3 means control room. And the control room may be your zone 3, but it's not zone 3 because it's a control room. There are really two tests to define whether a space is zone 3. Either there's a persistent MR physical hazard, such as a 5 Gauss line, penetration into that space, and that makes that space a zone 3. And or you can go from this space directly into the magnet room, and that makes it a zone 3. Now, usually control rooms meet one or both of those criteria, but not necessarily always. Because the 5 Gauss line is really not a line, it's a bubble, it can expand into adjacent spaces and even spaces above and below. So assess where your physical hazards are, and that will help you define your zoning and the associated protections. Now, inexorably linked to zoning is access controls. And we want to make sure that access into zones 3 and zones 4, the controlled access parts of the MR suite, is limited to people who have received the appropriate MR safety training. So we don't want the MR suite on the hospital master keying system that anybody who has a master key can let themselves in. We only want people who have gone through appropriate MR safety training to have independent access to zones 3 or zones 4. So my recommendation is that the MR suite is off of the hospital or facility master keying system, and that's on its own standalone keying system. I also recommend that we don't use combination locks. The combinations or passcodes can be really widely distributed before you know that the cat's out of the bag. So it's a poor way to maintain control over who gets in and gets out of your zone 3, zone 4 space. Which brings us to situational awareness or line of sight. We want to make sure that the suites are laid out such that seated at the console, the technologist can see who's coming into zone 3, who's about to go into zone 4, the magnet room, and seated at the console, we want the technologist to be able to see the patient inside the magnet, as well as anybody who is attending to the patient during that exam. If the door from the magnet room swings outward into the control room, then there's depending on which way it swings, there's the potential that the door in the open position blocks the view of the technologist seeing the entry to the magnet room door. Just another reason that I recommend that the magnet room door swing into the magnet room instead of out from. Non-ambulatory patient holding. A lot of our MRI safety practices, screening protocols, infrastructure are really based around the ambulatory patient. Even in a hospital setting, typically 70 to 80% of the patients are outpatient ambulatory patients. And that can make it easy if we're not being diligent to overlook the needs of non-ambulatory patients. Even in an outpatient setting, you're going to experience wheelchair-bound patients, patients with mobility issues. And we need to make sure that we anticipate that. That doesn't necessarily mean that we have to carve out all kinds of different additional space. We can actually look at double dipping some of our space, including our next item, induction and resuscitation area. So if you do inductions or have a necessity for providing a space for emergent resuscitation, you can double dip and make that space also your non-ambulatory patient holding area. For induction and resuscitation, we just want to make sure that resources such as a crash cart or infrastructure such as medical gases, that those are readily available at this induction and resuscitation area. Plan your facility so that you can make the most efficient and effective use of different spaces, and when possible, use a space to serve multiple different functions like this. Patient changing area. Now you may be saying to yourself, Toby, wait a minute, patient changing is not really patient safety, but it is. We're seeing increased incidence of burns resulting from antimicrobial or metallic conductor containing fabrics in street clothes. So we want to take care of that just to begin with. But more than that, I want us to address the potential conflict between throughput and safety. If we don't think about the problem holistically from the outset, we may find ourselves in a situation where throughput and safety are in competition. But if we plan ahead of time, we can fend off those potential conflicts. For example, throughput really, to a large extent, depends on patient prep spaces, changing spaces. If we provide a minimum of 2 changing rooms per magnet with lockers or belonging storage outside the change rooms, that will help reduce throughput bottlenecks. If you want to put the lockers or patient belonging storage inside the change room, then you really need to have a minimum of 3 change rooms per magnet room. When you're planning your facility, don't set up situations where throughput and safety are competing. Try and address these situations holistically, and then they will work together more so than compete. And speaking of patient belongings, we need to make sure that we provide appropriate provisions. Now, if you're in the south of Florida and your outpatients walk in with a t-shirt and shorts and flip-flops, you probably need relatively modest patient belonging storage. But if you're in northern Minnesota and you think of January, February, you may have a patient who has a Michelin Man down parka and snow boots and 7 layers of clothing, all of which need a place to stay. So contemplate sort of the worst case predictable situation with respect to patient belongings and build your storage area to accommodate that kind of situation. Ferromagnetic detection systems. So there are really two primary different forms of ferromagnetic detection. The type we use at the doorway into the magnet room and the type that we use in Zone 2 as a patient screening adjunct. Make sure that, if at all possible, you have both types. They serve different functions even though you may get them from the same vendor and they may look similar. The place where they're positioned and the activity in terms of patient preparation and patient screening are vastly different in those two different locations, and so the way we use ferromagnetic detection is profoundly different. My recommendation is to have both, to use it as a Zone 2 screening tool and to use it as doorway protection as you're about to enter the magnet room. Quench button. Now, I'm not going to be the first person to suggest that you have one, but what I may suggest that you might not have thought about before is, where are we going to place it? You have the option to place quench button where you want. In fact, you can have more than one. My suggestion is that if you're placing it in the control room, you don't have it near the magnet room door. Have it on the far side of the counter. If you're placing it inside the scan room, similarly, don't have it right next to the door. Maybe place it on a rear wall or the far wall. That will keep it out of the path of travel of your average patient and make it less likely that somebody will go, oh, hey, what's that? And hit the button. Those types of accidents, while not terribly common, do happen fairly regularly. And so we want to try and avoid inadvertent accidental quench button activation. Staff entry. Now, I'm not recommending a staff entry, but I know a lot of facilities have a back door into their Zone 3. Maybe it's for staff, maybe it's for inpatients because we want to separate inpatient and outpatient flow. Whatever the reason, if you have a back door into your Zone 3, stop and take a close look at your screening process that you really intend to have, and then ask yourself the question of, do I have everything in place to perform that screening function on anybody who comes in through the back door? That may be nursing, that may be a radiologist, it may be an anesthesiologist, it may be an inpatient. But in any case, we're going to want to perform some kind of screening functions on that individual. If all of your screening is predicated on the folks who walk in the front door and no thought is given to the folks who walk in the back door, you're probably missing important opportunities to screen people who are coming in. So contemplate whether you want to have storage bins or a ferromagnetic detection screener system located at the back door staff entry into your Zone 3. So that's it. Those are the 10 points for planning safer, more effective MRI suites. And as I say, I would encourage you to take a look at your existing facilities and identify the degree to which your current facility does these things or neglects some of the things, and generate your prioritized wish list of how you would like to see things improved from your current situation. Now, if you liked this information, this video is actually an adaptation of a download that you can get directly from the Metrasens website. And the URL is on the screen for you right now. And that will take you directly to the top 10 MRI suite safety planning principle handout, hard copy. While you're at the Metrasens website, I would really encourage you to check out all of the other MRI safety resources that are there. There are podcasts, there are webcasts, there are other, takeaway handout materials. If you are fortunate enough to be planning capital projects, there's an architects and planners resource guide for ferromagnetic detection systems. So please, I invite you to take advantage of all of the resources, all of which are free, on the Metrasens website. And with that, I would like to thank you very much for your time and attention. I would like to wish you a very safe, very productive MRI Safety Week. Thank you very much.